A meeting of the Pitt County Board of Health. We'd like to go ahead and open the meeting. First of all, are there any public comments tonight? Okay, hearing none, we'll move on to the approval of the minutes of the March meeting. So moved.
Second.
Okay. Any further discussion? All in favor say aye.
Aye.
All right, the minutes are approved. Thank you very much. Let's move on to John Reed and the fiscal report.
Thank you, Mr. Chairman. Good evening. You have the April 30th financial report in front of you. That takes us through 10 months of our fiscal year. I'll just go over a few items on this report briefly. If you look at the year-to-date 30 April 2016 column, you'll see that our revenue through 10 months is about $7,663,000 versus expenditures of $7,531,000. That gives us an in-the-bank surplus of about $232,000. I have also made some timing adjustments to try to match the revenue with expenditures. After taking into account those timing adjustments, that positive surplus actually goes to a deficit of about $128,000. And what is driving that is the changes I have made in the estimates to our outstanding Medicaid cost settlements. I've been looking at all the documentation, emails back and forth about the discussion between the DMA and the Public Health of North Carolina. So a couple of things to note. If you'll look down in those yellow highlighted rows, the Medicaid cost study for 2015, if you'll see in the budget, we budgeted $533,600 for the 2015 cost settlement. The formula was retroactively changed. So the best estimate I can get now, and I'm hoping it's a conservative estimate, that we will not receive the $533,000, but probably something more like $250,000. So and we would normally get that at the end of the, very close to the end of the year, or actually maybe early into the next fiscal year. So 10/12 of $250,000 is the $208,000, which I put into the timing column. So I've really reduced my estimate more than half on the 2015 cost settlement. The 2014 cost settlement, if you'll remember, the state told us early on we were going to get $708,000. We actually got $247,000. A lot of discussion going back and forth. Well, are you going to get some more of that, or how is that going to affect you? In the past, I've been hoping that, hey, we are going to get that 708. The more I glean from these emails and conversations, I think it is prudent to go ahead and recognize that right off now. There's an old term in finance, if you're going to take a bath, let's get clean. I think it would be go ahead and prudent if we went ahead and wrote that off. If something happens and we do get a portion of that, it'll just be a positive when it comes. If you also look at the 2013 cost settlement, there was some early discussion that we might be in a payback situation with that cost study. It does not appear that that is going to be the case now. So when you put all that together, at the end of April, 10 months into the fiscal year, we're about $129,000 deficit. However, two caveats with that. We've budgeted this current year's $371,000 of fund balance to use to support our operations. And you'll note in the financial report, we haven't brought any of that fund balance into play yet. So we haven't accounted for that yet, and we still have 2 more months to go. I really think that, and we've already cut our expenditures, so I really think that $129,000 deficit will either dramatically shrink or possibly go completely away. And all the deficit, again, is being driven by that reduced estimates on the Medicaid cost settlement. And Mr. Chairman, board members, I'll be glad to attempt to answer any questions.
Does anybody have any questions for Mr. Reed? So there's no way for us to get any more definitive answers from the folks in Raleigh, huh?
I've looked at every email that has been copied to me, and you can go through and glean a lot of information, but it's all unofficial, and it's still in discussion. Those talks are continuing, and if you can judge the tone of the conversation, the tone seems to have swung more in the favor of the local health departments, and I know that is a nebulous statement to say, but if you can glean anything from it, it does seem like maybe it is going our way a little more than it has in the past.
Do you know who is actually in control of the final decision?
It would be Secretary Brazier, my understanding.
Well, it's actually federal. They've submitted the SPA, or state plan amendment, to the feds. If that's approved, then what we're hearing at least is that we'll get additional funding from the 2014 settlement. The 2015 formula, if applied, will be a decrease in what we thought it was going to be, but not as bad as we thought 6 months ago. In addition to this, there's also in the governor's budget funds that have been put in to help solve this problem in terms of compensating local health departments for their losses this year. So if that gets approved, this picture will be better. But I think Mr. Reed's correct in his conservative approach, and we think probably we're going to end up with something better than what we've got now, which is good. But how much better, we don't know until the check's not only in the mail but received and cashed.
So how is this going to drive what the health department can do as far as rendering services?
Right now, I think we haven't cut any services. We haven't cut any positions. We've let some lapse. We've been careful not to overspend. As John mentioned, we've cut expenditures. So I think we're okay right now. You know, we're going through, as everybody is right now, with healthcare reform, a lot of changes coming up quickly. And so we've got to figure out how that's going to impact us in terms of our clinical services. We met today, our clinical management team met today talking about some of that. We've got an electronic health record that we've got to get installed. We've been dealing with that now for a couple of years, and it's time that we've got to do it very soon. So those kinds of things are going to have a big impact because we may have to cut back on appointments in order just to install an electronic record system, just as an example. If any of y'all have been through that, you know what I'm talking about. So that could take some time and puts a lot of stress on our staff. But I think the bigger picture is what's going to happen with the whole health system in terms of Medicaid reform, you know, where local health departments are going to end up after all the cards get shuffled.
Well, if worst case scenario came along and you didn't have more cuts or less reimbursement, I think we have the authority to have a meeting. You know, if we had to have a meeting and approve an emergency budget, we won't plan on that, but we have that in our pocket that we could. So, so you know, y'all keep us informed, and we'll be glad to. If we need to call an extra meeting, we're glad to do so. So, the fiscal report is up for approval. Is there a motion?
So moved.
Is there a second? Second. Any further discussion? All in favor say aye. Aye. Any opposed? Okay, report's approved. Can we move on? We'll move on into new business, and do you have a further update for us here?
I do have a further update on the 2017 budget. As you recall, we submitted this budget to this board to approve last meeting, or meeting before last, I believe, in March. The budget you approved is the requested budget on your report. It's $10,154,903. Since then, Dr. Morrow and I have met with the county manager, to discuss this budget, and we've also gotten some updates from the state. So there is some changes in the budget. The overall budget has increased by $176,674. That's driven in large part by an additional state funding of about $128,000. The county manager also included in our budget, wanted us to include in our budget a 1.4% cost of living increase. The recommended budget now includes that. We have also gone back and to fund some of our requests. We have eliminated one vacant PHN2 position, which was a long-standing vacant position. And what we've done in the past is we kind of had that position on the books. We never filled it, but the county manager would allow us to reallocate that salary and fringe to support two part-time nurses who did postpartum visits. And it was actually a little bit of a savings when we do it like that. But we've gone ahead and just formally eliminated that position. It was kind of silly to have a position out there that was never going to be filled. So once we took all that into account, our budget did increase by $176,000. One thing the county manager did do was he requested that the increase in the county appropriations would come from the fund balance and not from current appropriations. So you'll see in the line where it says county, last year, the 2016 adopted budget, the county appropriations was $4,516,000. That is what the county manager has asked us to do again. He wanted us to fund the increase this year out of our restricted fund balance. And we will meet with, do the budget workshop on May the 20th with the full Board of Commissioners.
Very good. Does anybody have any questions for Mr. Reed? All right, thank you very much. Let's move on to food and lodging report. Ron Honeycutt.
As Ron's coming up, I'll just tell you I wanted Ron to come tonight and present some of the great stuff that's going on in the Division of Food and Lodging. Ron's taken over as supervisor there in the last couple of years, and he's brought on some new staff here in the last couple of years and really done a really good job with getting that work going very well. So I wanted him to come and brag a little bit tonight.
Okay. I don't get to talk much about environmental health, but I really appreciate the opportunity because we're kind of behind the scenes. We're doing a lot of things, and we've got a really great team, and they've worked really hard. And so it's a great opportunity. A little bit closer there. It's a great opportunity for me to kind of present a few of the accomplishments we've done. It's not going. There it is. Some of you may or may not know that the state of North Carolina requires all county health departments to do inspections of facilities. There's 30 different kinds of facilities we have to inspect: restaurants, food stands, things like that. They're based on a risk frequency, 1 to 4 times a year. And that's based on the kind of menu they've got. If we look at these, this is what the state bases our 100% inspection criteria on. So they're restaurants, food stands, meat markets, nursing homes, educational lunchrooms, and institutional foods. This past year, we did over 1,700 actual inspections. That translated to 99% compliance. It was actually a little bit higher than that, but the state rounds it to the next number. So when we look at this, it's a big, big accomplishment because in the last 13 years, this is the highest Pitt County's ever gotten. And we're really, really proud of that. And the staff really, really worked hard. Our attempt this year is to get 100%. We're on track for it right now. Another accomplishment, we're one of 5 counties in North Carolina to receive grants from the U.S. Food and Drug Administration. We received $39,000 this year in 3 grants. We're one of 5 counties in North Carolina that got that. This kind of comes in the heels of about a year and a half ago. We got another 3 grants from the FDA for $24,000, which was one of 2 in the whole country. So I think that speaks a lot about our department and what we're doing. What is the National Retail Program Standards? Well, this is a standardized national program for the uniform between different state and county regulatory agencies. It's made of 9 different standards. We currently meet standard 1, 7, and 9. We're working on standard 3. There's about 2 states in the country that meet all of those standards. Right now, North Carolina does not, but we're working hard to do it. What this program also does for us, it promotes a wider application of effective risk factor intervention strategies for public safety. It also assists in identifying program areas most in need of additional attention. So what we do is we look at this thing, we look at it in terms of staff development, the risk factors that are involved in restaurants and food safety for the public, and things like protocols, procedures. Are we doing things right? Are we doing what we need to be doing? It also provides some information to justify maintenance or increase our program budgets. We've talked about budgets with John, and I'm not here to talk about budgets, but it's another way to look at, do we have the manpower to do what we need to do? And the program standards helps us with that. The 2 big things that the program standards do for all of the different agencies throughout the United States, it leads to a standardization of food safety, implementation, and administration. What this does, it improves consumer confidence and food protection by enhancing that everybody's doing the same thing. We're using the same rule book. And this is all based on science. It's not based on opinion, it's based on science. What's going to make people sick, what's not. Also, in this last fiscal year, we did about 209 permits. Permits are things that we do to allow a restaurant to operate, to sell food to the public. Of these 209, 87 were new permits for new facilities. Some were restaurants, some were remodels. 30 were changes of ownerships. 10 were new produce markets that we've never had before. 4 were new food stands. And then the list goes on. And we had 122 permits that were for festivals. These are the people that go out to the festivals and they sell the hamburgers, the hot dogs, the sausage dogs, whatever. Each one of these permits requires background work. It might be a plan review, it's an inspection. So it's not just a permit. We have to make sure that before we write the permit, they meet the rules and safety standards. Also, with all the other work we also did a huge survey of restaurants and food stands and institutional food. Over 230 different facilities were looked at, looking at 19 different food safety standards, such as food temperatures, employee practices, handling of the food, and the food sources. When you looked at all of that data, the number 1 issue that came out of all of these places we went to, and including hospital, nursing homes, everything, was temperature. Cold holding was 62%. In other words, they could not meet the standard of 41 degrees. North Carolina is one of the few states that still uses 45, but that's going away in 2019. So we're right now on a separate project with one of these grants, looking at what we can do to get them ready for this 41 degrees. Because 41 affects the temperature of the bacterial growth, it affects the shelf life, and it affects things that can make us sick. We got a long way to go right now. As we look at all of the work that goes on in this county, one thing is very, very knowledgeable to me. The county is growing. We're seeing it every week. People are contacting us for new requests for permits, mobile food units, and it's not going to slow down as long as the economy is working. What does that mean to us? It means we're having to do more inspections, dealing with more facilities, more places. If we look at number of people based on an FDA standard, 280 to 320 inspections should be done by person. We're at 422 per person right now. What that means is we're 140% of the FDA standard. Because of that, we have asked the state of North Carolina Department of Human Health and Health Services to do a program assessment. That program assessment was done, says we need an additional 3.69 staff members. We're not trying to be greedy, but we did ask for 1 additional food and lodging position in the new proposed budget. Are there any questions?
I have a question.
Sure.
You answered part of it when, about the grant money that you're receiving, that you're using it to help bring the people up to the 40, or down to the 41 degrees. What are you using the other monies for?
A lot of the money's been used for equipment, some computers, different kind of testing things like thermometers. We've even got some things now that very few health departments have where we can actually put a device in a refrigerator and monitor what's going on in that refrigerator
Remotely?
remotely. And we can actually download that into a computer and it can show us exactly what's going on in there. Because one of the things we run into is, from a food safety standpoint, if I'm cooling a big pot of soup, how long does it take to get down to 41? Because if it takes a long time, bacteria could grow in it. And you and I eat it, we could get sick.
So the equipment that you're buying is out-of-budget items?
It would be things we normally would not be able to buy.
Okay, good.
So it's a huge gain for us. That's why we're going for these grants. Good question.
Does anybody have any other questions?
Yeah, one more then, nobody else. When these food vendors travel from county to county, they have to get per county recertification or permit per county when they change, or is there a regional permit that once they're permitted, they permitted for X number of days or X number of
Yeah,
regions?
the way that works is if a food truck or mobile food unit has a permit in another county and they come to our county, they can use that permit for a one-day event. Now, if it's longer than a one-day event, they have to go to what's called a temporary food permit. And that's the bulk of the permits we wrote last year because of all the festivals.
And
And then there are some that are just illegal.
so what type of manpower is required if it's a more than a one-day permit for them to recertify or re-permit or extend the permit?
We actually have quite a bit of manpower that we have to deal with it. If it's a festival, we have to get information from the festival coordinator weeks before the actual festival starts. Then we have to contact all of these vendors that we think are coming. And we have to get applications, and there's a fee associated. When the event comes, we have to physically go to see these folks and then inspect their facility, trailer, whatever it might be, make sure that the food they've got is wholesome, not something from another festival that they're trying to use here. And we have that sometimes, and then we have to write a permit.
So they can't open for business until they have that?
Yes.
Is that permit displayed publicly?
It is supposed to be. Yes, sir.
All right, very good. Any other questions? Thank you very much for your report. Do we have anything to approve or just? No. Okay, the next one is the tattoo temporary permit fee. We have Mr. Mark Phelps.
Afternoon. And as you stated, what I'd like to talk about for a few minutes is a proposal for a new fee for temporary tattooing permits.
There for a slideshow. Slideshow right here,
Here.
right there. There you go. From the beginning.
There you go. First, I'd like to take a few minutes to talk about what a conventional tattooing permit covers. They're covered by 15A NCAC 18A 3200, which are the rules governing tattooing from the state. And a tattooing permit is tied to both the facility and the artist. We permit a particular artist at a particular booth and a site. If that artist chooses to go to another venue to work, then they have to be permitted all over again. If they move from one booth to another booth in the same venue, they still have to be permitted again. The permits must be renewed annually, and there are strict requirements for both sanitation and sterilization to try and prevent any opportunities for infection. The fee set by Pitt County for this conventional tattoo permit is $200 per year. So why a temporary permit? Well, the tattoo artists themselves have contacted me, and they've expressed interest in having a short-term permit at a reduced cost. And the purpose for this is try to facilitate tattoo conventions here in the county. The permit validity would be based on the length of time the convention is in operation, and we would determine that based off of a review of the contract signed for that venue. Permitting setting would also have to meet all of the rules set forth by the state, including separate, distinct workstations for each artist. Floor covering must be impervious and cleanable. For example, if they went to the convention center and there were carpeted flooring, we would require a minimum of 6 mil heavy plastic be laid over top of the carpeting so that it would be cleanable. And individual tattooing areas would have to be separated using temporary walls of some sort. An example I gave is office cubicle walls, which could be set in place, and after the venue they could be removed. And all furnishings would have to be easily cleanable and in good repair. All the sanitation and sterilization requirements would be met also for this permit. Disposable tubes and needles are the ideal way to go. However, they could reuse stainless tubes and needles if an autoclave were provided. And if an autoclave were used, they would have to provide endospore test strips to verify the autoclave was functioning. Hand wash sinks with hot and cold running water under continuous pressure and antiseptic soap would have to be required, and they would be required to have at least 1 sink per 5 artists. The artists would have to be able to go from the hand sink to their workstation without handling anything, including door handles or gates. And of course, the site for the tattoo would have to be scrubbed with germicidal solution before they began applying the tattoo. As far as my recommendations for such a permit, the length of the permit would be limited to the length of the venue. What I would recommend would be 14 continuous days as a maximum. And the cost for the temporary tattooing permit would be $100 per artist. And the reduction in fee from $200 to $100 would be offset by the number of permits that we would issue at a single venue. Typically, an artist comes and makes application. We go to the venue, we evaluate the site, speak with the artist, and then we write a single permit in return. In this scenario, they would provide us with plans of the venue before we left. We go to the site, we may be permitting 15 to 50 artists at a single stop. And this same situation here with the temporary tattooing permits is used by a number of other counties, including Wake and Mecklenburg. And Wake County, I know, is set up the same way. They have a $200 fee for a regular tattooing artist and $100 for the temporary permit. And they've been very successful with this. The artists are convinced that they'll be able to bring conventions here in Greenville and hopefully, bring more money to the city. I've spoke with the state as well, and the state's recommendations follow right along with this as far as planning and preparation for it. Is there any questions?
I have a question.
Yes, sir.
Along the same line, out of my lack of knowledge of what tattoo artists do, there was a blurb on the TV about some of these tattoo artists doing piercings. Are they legally able to do that under the state statute law to do piercings?
Yes, we don't have any inspection requirements for body piercings, and I think the only rules, if I remember, Dr. Morrow, was that you have to be, is it 18 to have body piercing. That's
But it can be applied by any Tom,
Anyone.
Dick, or Harry, or Mary,
Yes, sir.
Jane, or Jean.
Yes, sir. I actually had a tattoo artist ask about the possibility of getting body piercing rules by the county, because he said that it makes them appear more professional to be able to say that, hey, we're inspected and we're licensed by the county to do body piercings. And apparently some of the other counties that he's worked at in the past do have rules for body piercing.
Thank you.
Yes, sir.
But we don't have rules for body piercing, is that what you're saying?
Currently.
Have you done any, just surveys or anything of the tattoo artists to see if this is a reasonable fee? Clearly, if they're doing the same, being charged the same amount in Wake County, it's probably okay, I guess.
Yeah, the ones that I spoke to, that was the main place that they've been going and working in the conventions was in Wake County, and they seem to be confident that at this cost they will be able to bring in the conventions.
Anybody have any other questions? Is there a motion to approve or
So moved.
second? Any further discussion? All in favor say aye.
Aye.
Any opposed? Well, thank you very much for bringing that forward to us.
Thank you.
How quickly would it take you to get this implemented?
I believe we'd have to put it in with the budget.
Yeah, we probably quickest go in the budget.
Oh,
Yeah,
Has to be approved by the county commission.
thank you.
all right, very good, thank you. Dr. Morrow, give us the health director's report.
Thank you, Mr. Chairman. Just a few things I wanted to go over this evening. First of all, I did want to let y'all know it was last month that there was the death of one of our staff members, Diane Scribner. Diane was one of our disease investigation specialists. She'd been with us for 23 and a half years, and she was 48 years old. She left work Monday afternoon fine, and had some respiratory distress that evening, was taken to the emergency room and died early that next morning, which was a real shock, as you can imagine, for her family and friends and our staff. So we are planning a memorial service for her. We don't have a date yet, but we'd like to plant a tree behind the health department in honor of Diane and the fine work that she did for us and people of North Carolina and Pitt County in particular. So a lot of people across the state have expressed their sympathies, and our thoughts and prayers continue to go out to her family and friends and family. So I did want to give you that sad note, but also I just wanted to update you on some of the things that are going on. First of all, influenza has not gone away yet. Typically it leaves about this time of year or disappears a little bit, at least, to where we're not talking about it as much. But we've had a lot of folks, even at the health department, our staff, that have been sick with it recently, along with other things. But just to let the public know that influenza is still out there. It's, you know, we talk about a flu season, but flu basically really is diagnosed year-round now. So it's even more important for folks to get their vaccinations. We're up to 46 deaths in North Carolina, and I did want to just show you this graph that demonstrates most of those. You can see there's 19 in the 50 to 64 year range, and then I believe it's 14 65 years and older. But there's a number there, 12 that are between 25 and 49, and we've had one pediatric death between 5 and 17 years of age. So very important that folks get their vaccinations, and even if you're not in these age ranges, you probably have family members that are. So it's so important that we protect those elderly and young and those people who have chronic diseases. And
Were these in people that had been vaccinated, the deaths?
some of these were, yeah. It's not specified here, but some of these were in folks who were vaccinated. A lot of these are in folks with chronic disease issues, and that happens every year, but not all of them. So there's still, you know, we're seeing more and more people get vaccinated every year because the vaccine's so much readily available, and people have taken it and they realize it doesn't cause the flu and it does work. So every year we're seeing a higher percentage of people accepting the vaccine, which is great. But we'd love to see this blank every year, because one flu death is one too many, unfortunately. Just to show you this is what the rate looks like over the year. This is actually influenza-like illness from outpatient visits across the state. North Carolina has a good surveillance system. We actually have a surveillance on all the emergency rooms that operate 24 hours a day, 122 emergency rooms across the state. And then we also have this outpatient surveillance on influenza-like illness. So the red line you see there is this year. The black one was last year, and then the blue one was the year before, 2013-14. So you can see there the last 2 years were more similar, with last year being a much higher incidence for a while there in early January. This year we saw our rate really go up right at Christmas, and then it went up higher even about February, in the middle of February. We thought it was heading down pretty well until just late April when it shot back up again, but has continued to decline since then. So we hope we're on our way out with flu for this year. But just a reminder for folks to always get their vaccine, and you have to do it every year because that vaccine, even if it doesn't change, your immunity drops off at about a year for most adults, so it's a good thing to get the booster. The other issue I just wanted to update you on, there's a lot of discussion about Zika. We discussed this at our last meeting a little bit, but there's been even more information that's come out recently. This is the map of countries with active virus transmission. You can see Brazil's the big one on there that got everybody's attention. Of course, the Olympics are scheduled to be there this summer, and a lot of people are talking about not going because of Zika. But also the Caribbean and Mexico has active virus transmission. This mosquito-borne disease is carried by the Aedes aegypti mosquito. We have the Aedes albopictus mosquito here in eastern North Carolina and most of the South. We do not have any Aedes aegypti identified yet, but we do have surveillance going on looking for it, and that includes here in Pitt County. Jim Gardner, who works with Mark's Environmental Health Division, is out there sampling the creeks and ditches and backyards and everywhere he can for mosquito larvae, and he checks those to see if any of those are Aedes aegypti. But we do have the cousin of Aedes aegypti, which is Aedes albopictus. They have proven that Aedes albopictus is capable of carrying this Zika virus. They've also recently proven, the CDC, that the virus does cause microcephaly in the children. You've seen the pictures of the babies in Brazil with small heads. We now know that the virus actually is the cause of that. The other thing we know is that the virus can be sexually transmitted. So I've got a situation, when we first heard about Brazil and this Zika virus, I thought it might be more like dengue or chikungunya that we've had some experience with the last few years. But this one is starting to look a little more threatening to us because of the Aedes albopictus mosquitoes that we have that are capable of carrying it, and the sexual transmission. So, you probably know someone who in the last 3 months has been to the Caribbean or to Mexico. And all it takes is for somebody who goes down and gets infected. They may not know they're infected because only about 1 in 5 people even get sick at all when they're infected with this virus. They can come back and then transmit that sexually to a partner, and we can have children that are affected with microcephaly or other problems as a result of the Zika virus infection. So this is something we're going to have to keep a close watch on, and there is some concern that it could become endemic or locally transmitted at some point. The good news is that right now all of the Zika cases in the United States are imported. So you can see here on the map, North Carolina is sitting at 11 cases. All of those cases have been imported. Somebody's gone down to the Caribbean or Mexico or somewhere and picked up the virus and then came back and was sick with it or showed signs or got tested and tested positive. So, but it's something that we do have to watch. And the state is keeping an eye on this as well as the CDC, and we're getting, this is an example of last week's bulletin, we're getting a weekly update that keeps us informed about what's going on, tells us about the testing, the surveillance of the mosquitoes, as well as guidance for healthcare providers in terms of serial ultrasounds for pregnant women if they've been exposed or potentially exposed. So we're keeping a close watch on this one.
And the treatment for this is?
There is no treatment, just like the other mosquito-borne diseases, often like dengue and chikungunya. You just have to get through it. These people don't get very sick though. So, and like I said, 1 in 5 are symptomatic, and even the symptomatic ones aren't very sick. So they're often able to function pretty well even though they've been infected. So the real risk is to the unborn child. And, if, I mean, I think, possible scenario is a man travels to the Caribbean, gets infected, brings it back. We don't know yet how long the virus survives in semen, but it may be a month or so later. He has sexual contact with a woman, impregnates her. The woman doesn't even know he traveled and doesn't know she's at risk. And then we have a birth defect as a result of the virus. So that's the kind of thing we worry about. Any questions about Zika? Okay. The last thing I wanted to touch on, you should have a copy of Senate Bill 779. You got a copy of that? This is a bill that was introduced in this short session by the General Assembly, and is really concerning to me and others. This is about drinking water and advisories, both in private wells and in public water systems. And I want you to just take a look at this and read it, study it a little bit. I think when I read it, it didn't sound too bad because it says if you can go by the EPA's standards, if you will, and use those standards. The problem is that the EPA standards have not been updated in a very long time. And they may not get updated because of political pressures in Washington on the EPA. So, we've always had the authority as a local health department and you as a Board of Health to step in when there were local concerns about the people's health, the public's health of Pitt County, particularly around water, air, food, any of those things. The Board of Health has the authority to help in those situations. As I read this bill, and you can read it for yourself and make your own determination, but as I read it, it is in essence a gag order on your authority as the Board of Health and my authority as the Public Health Director. If I think there's a water contaminant in a local well or even in one of our public water supplies here, what this bill would do if it becomes law would make it illegal for me to notify a member of the public that their water has a contaminant that may be unsafe in it. Unless that contaminant is listed by the EPA. And there are a lot of contaminants, as you can imagine, the situation in Flint, Michigan recently with lead, they ran into some of these same problems. Their public health folks did not have the authority they needed to safely help protect the public's health there. So this bill is also in the House. It's House Bill 1005. And you can go online and look at the sponsors of it. It's been referred to an agricultural committee, which I think that in and of itself is inappropriate. This is a health issue. Drinking water is one of the main issues of public health. And we need to be able, as a Board of Health and a health department, I think, to make sure that the water is safe for our public, the air is clean, and the food is safe. And this bill, if passed, would stop us from doing that, in essence.
Where,
Dr. Aycock.
when would this be voted on? Or,
Well, it's in the General Assembly. It's already been introduced and referred to committee, so it depends on when it comes back out of committee. Hopefully, in my opinion, it doesn't come back out of committee, but I don't know to answer your question when it may get voted on.
what was the motivation? I mean, was there something,
I think what motivated this, as I understand it from people I've talked to, was the coal ash situation across the state. I don't know how much you've kept up with that. We're fortunate in that we don't have a coal ash pond in Pitt County, but many of the coal ash ponds across the state were being tested. They put monitoring wells in, and there was some real concern about a compound called hexavalent chromium. The EPA does not have any safe levels for hexavalent chromium in its standards. The state has some what they call guidelines that says, based on the best science that they have at the time, that a certain level of hexavalent chromium may be hazardous. And so they notified those residents that they're it's an advisory. In other words, it's not something you have to fix. It's basically the ability for public health to notify the homeowner or the occupant of that home to say, you have a contaminant in your water and it may be hazardous. That's basically what that advisory says. And they did that. This bill, if passed into law, would prevent anyone from doing that. It would make it illegal for the public health department to tell them that there's a contaminant in your water, it's hexavalent chromium at a level of X, and that level may be hazardous to your health.
Unless it's listed, it's one of the items
And it's
listed on
not.
the EPA, and that one was not.
That one is not. So that's an example of, I think that's, to answer your question, that's what I think stimulated this legislation.
Dr. Morrow?
Yes, sir.
It's not just that it's listed, but it has to reach a level above what they consider the maximum allowable.
That's correct.
Okay.
Does anybody have any other questions, or?
I was wondering if there's anything if we could do as a member of the Board of Health, or if just a citizen, that write letters, I guess anything more we could do?
My advice would be to contact your legislators. As I've seen, our local legislators have not signed on to this bill as sponsors, but so I think we can hopefully convince them to vote against it, or call the other legislators also and make sure that they don't pass this bill. I think it takes away the authority of our local boards of health. The other thing I would say, if you wanted to, do a proclamation, I'll be glad to draft that if y'all so direct me, and send that to the General Assembly and to the governor and the secretary with your concerns.
I think that would be helpful.
I'd like to
I
make
think
a
that
motion
hexavalent
that we
chromium
do.
was the stuff in that Julia Roberts movie with
That's right,
Aaron Brockovich. That was the stuff causing
that's right.
the bad stuff there in that movie.
Well, motion's been made by Dr. Aycock and seconded by Rex Fleming. Any other discussion? All in favor say aye.
Aye.
Any opposed? Dr. Morrow, you have the authority to go ahead and start drafting up a
Do
statement.
that and send you a copy of it for your signature. So, thank you.
All right. Is there any other new business? I'll just mention, Dr. Morrow sent out an email today talking about this is National Nurses Week, May 6th through 12th, and commented that certainly the large role that the public health nurses play in the making up 30% of the public health workforce in the state of North Carolina. So you can have the best doctors in the world, but if you don't have nurses as part of your team, you're not going to get a lot done. So thank you very much, all you nurses out there, and appreciate all the dedicated hard work that you do. Is there any other business? Okay, hearing none, is there a motion for adjournment? So moved. Is there a second? All in favor? Any opposed? Meeting is adjourned. Thank you.